Hi, this is Dan Sullivan, and today I've got a great question from Kristen, and she is talking about the true indicators of heart disease, homocysteine and CP3 protein, which I think she means CRP, which stands for C-reactive protein. So I'll be talking about those two things today, and heart disease as well, and how to mitigate the risk for heart disease. You might have heart disease in your family, wonder if it's genetic or what you can do about it, and so she is right. The markers of inflammation are very good indicators of heart disease, among a lot of other things too. And so I did a video on cholesterol. There's a ton of myths around cholesterol, the effects of eating fats and your cholesterol or saturated fats. You've probably heard of that. Is eating eggs or egg yolks going to give me high cholesterol? And then will that give me a heart attack or heart disease? And so I did a whole video on that, so if you want to dive deeper, I would watch that, but I'll sort of touch on some of that stuff today as well. So we'll talk about homocysteine today, and what that is a marker of inflammation. And so homocysteine, I'm just looking here on my computer at the methylation cycle. So homocysteine is a part of the methylation cycle. And if you've never heard of that, that's totally okay. It's basically the way I explain this is the methylation cycle is sort of like the inner workings of a clock. So if you visualize that, there's all these different wheels spinning and reacting with each other, and they're all dependent on each other to work properly. And so what happens is if you have high levels of inflammation, specifically homocysteine in the body, that means there's a breakdown in your clockwork, so to speak. And so when that happens, that needs to be addressed. And so I like to see homocysteine levels of about 7 or less, even less than that, in patients or in clients of mine. And so when homocysteine starts creeping up over 7, over 8, 9, 10, 11, and even higher than that, it's really become a problem. And so you definitely want to address that. And so you do that by eating lots of vegetables. The methylation cycle is very dependent on B vitamins, among other things as well. Genetic factors can play a big role in that as well. And so doing a genetic testing from a company like 23andme.com is a great option, and that'll tell you some stuff about your methylation. But if you don't want to go down that deep, that's fine. Just make sure you're taking eating plenty of vegetables. You can either be eating them, you can get them in a smoothie, somehow just get them down. You don't want to be taking synthetic B vitamins, especially folic acid. So this is a known synthetic B vitamin that can in fact mess up the methylation cycle in a large percentage of the population. So especially those that are genetically prone to that. So you might have heard people talking about the MTHFR gene, the methyl tetrahydrofolate reductase gene. And so I know that's a mouthful, but that one has a big role in how you process B vitamins, to put it simply. So all that being said, homocysteine is definitely something you need to look at. If your doctor is not ordering that, I would definitely ask for it. The worst that can happen is they say no, but I would definitely ask for that marker, and also for C-reactive protein. So basically another marker of systemic inflammation in general with C-reactive protein. So with that being said, how do you get inflammation down? How do you reduce that risk of heart disease, heart attack, anything heart related? So number one, I recommend people do not eat vegetable oils. So stuff like canola oil, soy oil, corn oil, all these are going to be very pro-inflammatory, which is not what we want at all. And so especially when you heat these oils, a large proponent of those oils comes from polyunsaturated fatty acids, where you can call that PUFAs, right? So the easy way to think about that is when you heat up those oils, those PUFAs, they go poof in your body, right? They explode, they make a lot of stuff go wrong, and so they create a lot of havoc and a lot of inflammation in the body. And so you don't want to be eating that stuff. And so a lot of restaurants, a lot of fast food joints will be trying to cut the cost of their oils and their food in general, which I don't blame them for doing that. We all have to make money, but at the end of the day, one of my goals is to get great information out there to you so you can improve your life, you can improve your health. And so one way of doing that is either when you go out to eat, ask them to cook your food in something other than vegetable oils, ideally something like a more saturated fat, like coconut oil or like an avocado oil, or even just straight up, lard, something like that if it's from a good source. You can also use olive oil at lower temperatures. And so using those oils, they are very much less pro-inflammatory, so they're more anti-inflammatory. So that's a big one. And you can look into the book called Deep Nutrition, and she gets into much greater depth than I will today. It's a pretty large book, but I'd highly recommend that, specifically for talking about vegetable oils and the toxicity of those. So you definitely want to avoid those. And also, sugar is very pro-inflammatory as well. And so that can create stuff called AGEs, or advanced glycation end products. And these are basically going in your body and wreaking havoc. They'll literally age you. That's a very easy way to remember that. And so when you reduce stuff like sugars, refined carbohydrates that turn into sugar in the body, you reduce those vegetable oils, those pro-inflammatory polyunsaturated fatty acids, from the canola oils, the vegetable oils, you're really going to reduce your inflammation and that load. And you should see things like your homocysteine and your CRP reduce. And so when that happens, you're in much, much better shape for heart health in general. So I hope all that was helpful. The methylation cycle can get a little bit dicey. I would recommend reaching out to or looking up articles research by Ben Lynch. He's a naturopathic doctor who really dives deep into the methylation cycle. So if you want to go deeper, I'd highly recommend that. It's a pretty vast topic, and there's still a lot to learn about methylation and genetics. But in general, if you do those few things, if you just limit your sugar, cut down on the vegetable oil intake, using more good quality fats, those more saturated fats from high quality sources, the coconut oils, the avocado oils that can tolerate higher heat and not oxidize and not break down and not become so inflammatory to you, you're going to really reduce the risk of getting anything heart related, and a lot more than that as well. So hopefully that was helpful. I'll put a couple links down below to the methylation cycle, some supplements that can help you to reduce stuff like homocysteine in the short term besides just eating vegetables, and then giving you a couple links to some of the good oils that I like to use for cooking especially. So hopefully that was helpful. Please comment below if you have any questions, and appreciate you watching. Thanks so much.